Hello guys, I hope that you will be fine and enjoying good health. Today I have selected my topic on deviated nasal septum. A deviated nasal septum occurs when the thin walls nasal septum between your nasal passages is displaced to one side. In many people, the nasal septum is off center or deviated, making one nasal passage smaller. When a deviated septum is severe, it can block one side of the nose and reduce airflow, causing difficulty breathing. The exposure of a deviated septum to the drying effect of airflow through the nose may sometimes contribute to crusting or bleeding in certain people. A nasal blockage or congestion obstruction can occur from a deviated nasal septum, from swelling of the tissues lining the nose, or from both. The treatment of nasal obstruction may include medication to reduce the swelling. To correct a deviated septum, you may need surgery. What are the symptoms? Most septal displacement result in no symptoms, and you may not even know you have a deviated septum. Some septal deformities, however, may cause the following signs and symptoms: obstruction of one or both nostrils. This blockage can make it difficult to breathe through the nostrils or nostrils. You may notice this more when you have a cold or allergies that can cause your nasal passages to swell and narrow, and you may have nosebleeds. The surface of your nasal septum may become dry, increasing your risk of nosebleeds. Then you may have facial pain. There is some debate about the possible nasal causes of facial pain. A possible cause of one-sided facial pain could be a severe deviated septum in which surfaces within the nose touch and cause pressure. Then noisy breathing during sleep. A deviated septum or swelling of the tissues in your nose can be one of the many reasons for noisy breathing during sleep. Then awareness of the nasal cycle. The nose alternates between being obstructed on one side and then changes to being obstructed on the other. This is called the nasal cycle. Being aware of the nasal cycle is not typical and can indicate nasal obstruction. And then preferences for sleeping on a particular side. Some people may prefer to sleep on a particular side to optimize breathing through the nose at night if one nasal passage is narrowed. When to see a doctor? See a doctor if you experience a blocked nostril, a nostril that does not respond to treatment, or if you have frequent nosebleeds or recurring sinus infections. What are the causes? A deviated nasal septum occurs when your nasal septum, the thin wall that separates your right and left nasal passages, is displaced to one side. A deviated nasal septum can be caused by a condition present at birth. In some cases, a deviated nasal septum occurs when the fetus develops in the womb and is apparent at birth. And another factor is the injury to the nose. The deviated nasal septum can also be a result of injury that causes the nasal septum to be moved out of the position. In infants, such as injury may occur during childbirth. In children and adults, a wide array of accidents may lead to nose injury and deviated septum. Trauma to the nose most commonly occurs during the contact sports, rough play such as wrestling or automobile accidents. The aging process may affect nasal structures, worsening a deviated nasal septum over time, and swelling and irritation of the nasal cavities or sinus cavities because of an infection can further narrow the nasal passage and result in nasal obstruction. What are the risk factors involved? For some people, deviated nasal septum is present at birth, occurring during fetal development or due to injury during childbirth. After birth, the deviated septum is most commonly caused by an injury that moves your nasal septum out of the place. Risk factors include playing contact sports and not wearing your seat belts while riding in a motorized vehicles. What are the complications? A severely deviated nasal septum causing nasal blockage can lead to dry mouth due to the chronic mouth breathing. And then it can cause a feeling of pressure or congestion in your nasal passages and disturb sleep due to the unpleasantness of not being able to breathe comfortably through your nose at night. And what are the preventive measures? You may be able to prevent the injuries to your nose that can cause a deviated nasal septum with these precautions. Wear your helmet or a mid-face mask when playing contact sports such as football or volleyball, and wear a seatbelt when riding in a motorized vehicle or when you are riding on a motorbike. Diagnosis is by during your visit, your doctor will first ask about any symptoms you may have, and to examine the side of your nose, the doctor will use a bright light and sometimes an instrument designed to spread open your nostrils. Sometimes the doctor will check farther back in your nose with a long tube-shaped scope with a bright light at the tip. The doctor may also look at your nasal tissues before and after applying a decongestant spray. Based on this exam, he or she can diagnose a deviated septum and determine the seriousness of your condition. If a doctor is not an ear, nose and throat specialist and you need treatment, he or she may refer to a specialist for further consultation and treatment. What are the treatment options? Managing symptoms. Initial treatment of a deviated nasal septum may be directed at managing your symptoms. The doctors may prescribe decongestants. Decongestants are medication that reduce nasal tissue swelling, helping to keep the airways on both sides of your nose open. Decongestants are available as pill or as nasal spray, but use nasal sprays with caution. Frequent and continued use can create dependency and cause symptoms to be worse after you stop using them. Oral decongestants have a stimulant effect and may cause you to be jittery as well as may make your blood pressure, heart rate go up. These may be including the sinus sprays. And then is the role of antihistamines. Antihistamines are medications that help prevent allergy symptoms, including a stuffy or runny nose. They can also sometimes help non-allergic conditions such as those occurring with a cold. Some antihistamine causes drowsiness and can affect your ability to perform tasks that require physical coordination such as driving. And then is the nasal steroid spray. Prescription nasal corticosteroid spray can reduce swellings in your nasal passages, budisones and fluticasone, and will help with the drainage. It usually takes from 1 to 3 weeks for steroid sprays to reach their maximal effect, so it is important to follow your doctor's direction using them. Medications only treat the swollen mucous membranes and would not correct a deviated septum. Then is the surgical repair. If you still experience symptoms despite medical therapy, you may consider surgery to correct your deviated septum, which is called a septoplasty. During a typical septoplasty, the nasal septum is straightened and repositioned in the center of the nose. This may require the surgeon to cut and remove part of the septum before reinserting them in the proper position. The level of improvement you can expect with surgery depends on severity of your deviation. Symptoms due to the deviated septum, particularly nasal obstruction, could completely go away. However, any other nasal or sinus condition you have that affect the tissues lining your nose, such as allergies, can be cured with only surgery. Reshaping your nose. In some cases, surgery to reshape the nose, rhinoplasty, is performed at the same time as septoplasty. Rhinoplasty involves modifying the bone and cartilage of your nose to change its shape or size or both. Preparing for your appointment, you are likely to start by seeing your family doctor or general practitioner. However, in some cases, you may call to set up an appointment. You may be referred directly to an ear, nose, throat specialist. Your time with your doctor is limited. So, preparing for the doctor's question to you as well as creating a list of questions to your doctors can help you make the most of your time together. For a deviated septum and its complications, some questions your doctor may ask include: how long has your nasal obstruction been present? How much of the time are you aware of the nasal obstruction? Is one side of your nose worse than the other? Is the obstruction mild, moderate, or severe? Have you had any trauma to your nose? Do you have allergies affecting your nose? Do you have a decreased sense of smell? Do you have problems with sinusitis? Do you have nosebleeds? Is there anything else that makes the obstruction worse? Is there anything you do that relieves the symptoms? What medications have you used previously for this problem, and what medications are you currently taking for this problem? Does the decongestant spray help you? Are you currently using decongestant spray every day? Does using a nasal adhesive strip help? Is your nasal obstruction worse when you are lying down? Have you had any nasal surgery before? Some basic question you might ask your doctor might include: what is likely causing my symptoms or condition? What is the best course of action for my issue? And what are the alternatives to the primary approach that you are suggesting? I have these other health conditions, and how can I best manage them together? Are there any restrictions that I need to follow? Should I see a specialist? In addition to questions that you have prepared to ask your doctor, do not hesitate to ask further questions during your appointment. Symptoms are blockage of one or both nostrils, nosebleed, facial pain, noisy breathing during sleep, awareness of the nasal cycle, preference for sleeping on a particular side. Causes are a condition which may be present at birth, which may be a defect or birth defect, or it may be because of an injury to the nose, because of some accident or some sport related injury. Risk factors are playing contact sports and not wearing your seatbelt while riding in a motorbike vehicles. Complications will be including dry mouth and feeling of pressure, congestion of the nasal passages and disturbed sleep, and difficulty in breathing comfortably through your nose at the night. Prevention is by wearing a helmet and wearing a seat belt while riding a motor bike. As far as treatment is concerned, treatment include decongestants and antihistamines such as avastin, fexofenadine, tafenadine, estomizole, and chlorphropamine. Nasal steroidal sprays including fluticasone, budesonide spray, and oxymetazoline and nafazoline sprays. And then will be the surgical repair, which is called as septoplasty, and sometimes you might need reshaping of the nose, which is called as rhinoplasty. Rhinoplasty involves modifying the bone and cartilage of your nose to change its shape or size or both. So this was all about the deviated nasal septum. I hope so that you would have liked this topic, and if you have liked this video, then don't forget to subscribe it and share my video with others as well. Have a wonderful nice day. Thank you very much for listening my video.